Hey everyone, thank you so much for coming to the Medicare 101 virtual seminar. We are so happy and glad that you could be able to make it today. Throughout today we're going to talk about, and during this time, about what Medicare is all about. We know that you're probably getting inundated with a whole lot of stuff to your mailbox and everything. And we're going to just go through each thing and we're going to make sure you understand what it's all about. All right? So one thing it says here on this slide, it says, I'm special because I know that you're special. One thing that you have to understand is everybody's special. Everybody has their own story to tell, and that story is special to them, and it's also meaningful to your life. One thing that I want to share with you today is the fact that I got into insurance because my dad got really sick. He was told that he didn't have coverage when he was out of the state of Arizona, because that's where he retired from. And when he went to Seattle to visit us, he got sicker and sicker. By the time he left Seattle, he was very ill. And we had told him when he was there he should go to the doctor, go to the emergency room, whatever. And they said that he wasn't, he couldn't go because he said his agent said he wasn't able to do that. But when he got home, unfortunately, it got worse. And on September 3rd, 1998, my dad passed away. So, interestingly, my dad sold home and auto insurance, and he always wanted me to be an insurance agent. He always asked if I could do it because he thought I would be really good talking to people and I cared about people and stuff. But I decided after a couple of years I was going to do health insurance, and I wanted to make sure that nobody had the same health insurance that my dad suffered from. But when I got trained, I realized it wasn't the health insurance that was the issue. It was the agent that gave him the wrong information. So then my mission has been to make sure that when I tell people about Medicare or anything else, that it's going to be able to cover you, it's going to be able to take care of you, and make a difference in your life. In fact, I'm going to tell you one story. This is a really powerful story before I go further, because this is who I am. Okay, this is why I do what I do. This one lady was walking down the street in New York City, one of my customers, and she got chest pain, and she remembered that when you have a problem, you go to the emergency room. Don't hesitate. So what happened was she went right to the hospital. And when she got in there, within 15 minutes, they put her under surgery because she was having a heart attack. The doctor came in afterwards and said, if you would have waited 30 more minutes, you would have not been alive. Why did you come in so quickly? And she said, because my agent, Jeffrey Woodruff, said that if I have a problem, I need to go right to the emergency room. And he said to her, because he did that and shared that with you, it saved your life. And she told me that story, and I'll tell you what, we both were crying on the phone because it made a difference. And I was able to look up into heaven and say, Dad, this one's for you, because this is the reason why I do what I do. I want to take care of people really, really well. And I know that you're special too, and because you're special, I'm going to make sure I take care of you like I took care of that woman that went to New York. Because each of you have also a different budget. You also have different needs for your medications, for your hospitals, doctors, and different specialists than everybody else, okay? And one size really does not fit all. I've gone into homes where one client, they wanted a supplement because that's what they felt comfortable with. Guess what? That was right for them. Their husband, on the other hand, said, no, I don't want a supplement, I want a Medicare Advantage plan. And so when I shared with him about the Medicare Advantage plan, he loved it, and guess what? That was right for him. Because you see, that's what matters. You matter. What you want matters to me. Because you deserve a plan with the benefits that's going to fit your needs and your budget, and also what you desire to have in healthcare. Now, why would you want to choose me? Well, I think besides the fact that I like to smile a lot and have fun with everybody, I'm also licensed and I'm certified and I'm trained to understand how Medicare works. Every year I spend 80 plus hours obtaining certifications from top Medicare carriers, and I'm also here for you throughout the year, not just during the annual election period. And I tell you what, I get calls every week helping my clients. That's what I love to do. I want to make sure that you are so well taken care of and that nothing gets past you. I want to be there for you. I must pass an annual AHIP examination. Who likes to take tests? I don't, But you know what? I do like to take them in this fashion. I want to make sure that I know all the information that I need to know to make sure that I pass that on to you to make sure that you're very well taken care of. And we cover Medicare, fraud, waste, and abuse. Unfortunately, things happen like that in the world. We will make sure that our customers are protected against that. I'm also trained to use Medicare.gov. And with that, we're going to compare your prescription drug plans. And the reason why we want to use Medicare.gov, because they're neutral. Okay, they're not, they're not a company. They represent all of the companies, and we want to make sure that you get a plan that covers you at the very lowest cost. Absolute service and promise to you is this: unbiased opinion. So this is so important to me because I don't want you to have a plan that I want. I want you to have the plan that you want. And the only way that I can do that is to ask you a lot of different questions and to make sure that everything that you want and desire in a plan is that what I'm going to fulfill for you. And then after you've decided which plan you want, I want to educate you on how that plan is going to work best for you. So I will teach you the ins and the outs of your benefits and make sure that you understand them clearly. And if you don't understand them, you can always call me, but I want to make sure you do understand them at the best of your ability. We also want to make sure that your doctor is part of your network because I know how important it is to have those relationships with your doctor, and we've got to maintain that with you. We also want to verify that you're placed within the network that will allow you to use the hospital of your choice. I mean, you wouldn't want to go into a network and you have to drive clear across town to go to an outpatient hospital. So we want to make sure that the hospital near where you live is going to be in the plan. We also will assist you in applying for extra help. We also call that low-income subsidy. Now that's going to help you with your prescription drugs. And if you qualify for that, don't worry about what you have to do with that. I will enroll that for you because this is my service to you to make sure that you're very well covered. I'd love to help you do that. We also have an annual benefit review to ensure you're always on an affordable plan. I'm going to tell you what, we're going to send out emails, we're going to send out letters, we're going to make phone calls, so you won't be missed. I tell you what, you won't be missed because we want to make sure beyond a shadow of a doubt that the plan you have this year is a plan you want to have next year. Now, my role and my only role is to help you navigate through the Medicare at no extra cost to you. I'm not going to tell you what to do or dictate this is what you should do. I just want to make sure you are navigating through Medicare and you understand every part of it. So when are you eligible? Okay, so the eligibility parts of that when you become part of Medicare, first of all, you are 65-year-old. And if you're under 65, you can qualify due to disability. Now, if you become disabled through Social Security, you will have to wait 2 years before you can get your Medicare. And sometimes there's other special situations, like if you have a transplant. A transplant will allow you to get Medicare coverage for the time that you're on the transplant until you recover, and then you go back onto another insurance policy. You do have to be a U.S. citizen or a legal resident, and you have to live in the United States for at least 5 consecutive years. Now, about the age 65, the magical age 65. I tell you what, you all know it, you've heard it. When you first started, that when you turn 65, you get Medicare. Well, you do. And you know what happened before? When you turned 65, you'd get Social Security, fully vested. But guess what now? You don't, okay? So things are different that way. So here's some things you do need to know. If you are not receiving Social Security benefits, you must, on your own, go through Medicare online or go to Medicare personally and sign up for your Medicare benefits. If you are already receiving Social Security benefits, then you will automatically get enrolled in Medicare. So that's very important to know. All applicants must be 65, and your spouse's age does not count. Now, let's say that you're turning 65 and your spouse is 60 and she has 5 more years to go. What do you do then? Guess what? We have solutions for that too. And in fact, we have some really powerful solutions that I think you're really going to like to help your spouse that's not 65 yet get some coverage as well. So even if you're not collecting Social Security yet and you are eligible at 65, make sure you take advantage of it. And if you don't, and you don't have other coverage, you can get penalties. So make sure about the age 65. Even if you're already getting Social Security, you have to wait until you're 65. Except if you have disability. Now if that happens, you have to wait 2 years after you receive your Social Security benefits in order to be eligible for Medicare on disability. Now all applicants must be 65, and your spouse's age does not count. One thing you have to understand, if you come in and you turn 65 and you get Social Security, doesn't mean your wife gets to have Social Security. She has to also be 65. But if she doesn't have a health care option, we do have options for our folks that are under 65 as well. Now, even if you're not collecting Social Security yet, you are still eligible at 65. One thing you must understand here is really important. Before, when you turn 65, with Social Security, you would get your full benefits. And then you'd also get your Medicare. And Medicare would automatically enroll you into the plan. Social Security would. But now, if you're waiting until you're 66 or whatever months after that to get full vesting in Social Security, you are going to have to go in either to the Social Security office or go online and create a My Social Security account to get your Medicare before you turn 65. Now, if you don't, and you don't have group coverage or credible coverage, you can be subject to a penalty. These are the reasons why you need to talk to me, because I'm going to make sure that you're completely taken care of before all of this happens to you. There are so many options. I mean, that's what the confusing part is. And I know all of you that are turning 65, you are inundated with mailings that you don't know what to do with, because I've seen the piles of stuff that you bring to me. I will help you decipher all of that stuff for you. First of all, let's make it a little simple. The number one thing that you're going to get to start off with is Original Medicare. It's your red, white, and blue card, and it's got a hospital, Part A, and a Part B medical. Now the Part A was paid for when you were working. Now if you worked for 10 years or 40 quarters, which again equals 10 years, then you've paid for Part A. But now there's housewives I know out there, and they say, well, I never worked. What about me? Well, guess what? If you have a husband that worked for 10 years, hopefully he wasn't a slouch, but he worked for 10 years, then guess what? You get Medicare because of him. Isn't that great? So that's how that works. Now, the next step is, what do we do with our Medicare? Do we just have that by itself? And the answer is probably not. And when you talk to me, I'll tell you why you probably don't want to just do Medicare all by itself, because it can get really expensive if things get really haywire down the road. So another option besides that is Medicare Advantage. Now, Medicare Advantage is also called Medicare Part C. That's what it's called, and it's also called managed care. They're made up of HMOs and PPOs. Let me explain to you what an HMO is. An HMO is a health maintenance organization, and you have to go into the network, and if you go out of the network, you're not covered, except for emergencies and urgent care. You are covered everywhere. Okay, so don't ever forget that. When you're in these plans, a lot of times there's no extra cost than the Part B premium, which you have with your original Medicare, which you have to pay every month, whether you want to or not. You got to pay for it. And then with the HMO, though, what we do is we have co-pays and we have co-insurances a lot of times, but it's really extra special coverage, and the drug plan is put right into the plan. And the costs on most HMOs are zero cost. There's a zero cost to those plans. All right? Now, number 3 option is Medicare Supplement. Now, a supplement is just that. It supplements Original Medicare. And there are plans A through N. Okay, there's plans A through N. Right now, the most popular plan is Plan G, and after you meet the deductible of $198, that's the deductible for Part B, then you're covered 100% for everything. And then along with that, you need to add a standalone prescription drug plan. So you put that together with the Medicare supplement, and when you do that, you're going to have 3 separate cards. You're going to have your original Medicare card, your supplement card, and your prescription drug card if you do option number 3. If you do option number 2, you're going to have 1 card. That Medicare Advantage card covers the whole thing. And that's one of the big differences. Now, so many plans and types and terms. So, we want to make sure you understand about the supplements. The supplement supplements original Medicare. So that's what you do when you want original Medicare, you put a supplement with that. Medicare Advantage, basically what it is Medicare pays private insurance companies to take care of you. All right? And so they take care of you, and Medicare administers them and makes sure that they follow all the rules, and they have to give you better benefits than original Medicare, which they do. Prescription drug plans, those are plans that are either standalone to go with the supplement, or they're combined inside of a Medicare Advantage plan. And those you have to have. Now here's the thing I want you to know, it's really important. If you don't take a prescription drug plan, one way or the other, they penalize you for that. So if you want to know more about the penalty, call Jeff, because Jeff will tell you how to avoid that penalty for sure. Then there's special needs plans. Now special needs plans are great for people that have chronic disease, or people that are on low income, or they move from one state to another state and they wonder, do I get coverage? Yes, you do. Call Jeff and he'll tell you how you get coverage for those things as well. Chronic special needs plans, things like diabetes or heart problems, you can get coverage, special plans to cover those conditions specifically for you as well. With your health maintenance organization, those, of course, you have to get a referral from your provider to go see a specialist. Okay, that's how they really work. They have a narrow network. Most networks on HMOs are county specific. There are some newer ones that have nationwide HMO networks, which is really nice, but the majority of them are county specific. A preferred provider organization, or a PPO, it allows you to go anywhere inside the network. There's absolutely no referrals necessary whatsoever, and you can go outside of your county, outside in anywhere in the United States, and have coverage with any provider of your choice. So that gives you a lot more flexibility, but the costs on those are a little bit higher, and the benefits cost a little bit more for those. The thing that I want to let you know is I'm here, and so if you don't know which plan to take, talk to me. I'll tell you which ones are the best for you, because you just ask the questions and I'll give you the answers. Now, with Medicare Part D, it's really important to know that there's different parts to Part D. If you want to know exactly how it works, I'll give you a little rundown. There's 4 main parts to Part D. The first part is deductible. So there's a deductible that you have to fulfill in some cases. In some cases, the plan pays for it. The next part of Part D is the initial coverage limit, and during that part there's a certain amount that you have to stay under and pay copays, and then you're fine and dandy. If you stay under that amount and all you'll be paying is the copays, that's great. And if you go over that amount during that second phase, then you go into what we call the catastrophic, or not, we call it the coverage gap, or the donut hole. Now in that phase, you got to pay 25% of either the generic or the name brand cost. And then if you really get over the limit, then we go into catastrophic coverage, and it's basically $3.60 and $8.95 for your prescription drugs. So there's different limitations, there's different time frames, there's different penalties, there's step therapy, coverage gap, which we can explain more in detail, drug tiers. There's so many different things that make up a drug plan, and it sounds confusing, but guess what? I will lay it all out for you, and you'll understand it fully and completely before you leave my office. So what now? Well, here's what we want you to do. And first of all, we want to thank you for staying with me through this whole virtual visit. I am so glad that you are here with me, and because you stuck around, thankfully. And if you would like to know more about what we are talking about and how to get through all this maze of confusion, here's what we want you to do. If you will fill out these forms that were sent to you, and if you'll do that, guess what? Not only get to see me, but we're going to give you a complimentary gift. That's right. Sign up. It's free. There's no obligation. I'm just going to help you learn about Medicare even further. And if you like what you hear, then we can move forward. But I want to let you know that I'm here. No pressure. Don't have to bring your checkbooks or anything. Just want to help you out and make sure you understand fully of what you're getting yourself into. And I'm here to help you do that. So what I really want to do is I want to thank you so much for being a part of this virtual seminar, and I hope very much to be able to meet with you, to talk with you, to help you to make sure you fully understand what the benefits are for you and how we can make it work for you the best. All right, thank you so much, and we'll talk to you later. Thanks. Thank you again, and also I want you to know that there's a little chat window right down on the bottom, and we do want to make sure that we answer your questions, because I know a lot of you have lots of questions, and we love to do that. So make sure you write out all your questions in there, and we're going to get right back to you, and we're going to go over it together to make sure that we answer everything you have. So please do that. Thank you again for coming to this virtual seminar, and we'll look forward to seeing you or hearing from you really soon. Thanks. Bye.